Tobacco was originally smoked by Native Americans but was brought to Europe during the late 15th century because explorers like Christopher Columbus were interested in it. Until the 17th century, only the wealthy were able to afford it, but tobacco became so widespread that eventually even the poor were smoking it. From the time it was discovered to 1860, tobacco was believed to have therapeutic effects and was applied topically to treat pain and skin diseases. Additionally, tobacco was used to cure diseases related to the head. The treatments would involve sticking the tobacco leaves into the sick individual's ears, nose, or mouth. In 1828, Poselt and Ryman, two chemists, were able to isolate nicotine in tobacco, and were able to prove that it was a dangerous substance, seeing as it was both toxic and addictive. From then on, several authorities, such as the clergy, educators, and physicians, began to express their distaste for the substance, and so there was quite a bit of backlash. Here, I've put a comparison between smoking statistics in the US versus Canada. In both countries, there has been a decline in the amount of people who smoke in the last century. In America, this decline was associated with the book Smoking and Health, Report of the Advisory Committee to the Surgeon General in 1964, which outlined the various health hazards associated with smoking. In terms of age groups, the highest smoking rates were found among 18 to 25-year-olds in the States, with men smoking more than women as they age. This trend is also seen in Canada, with more males smoking than females. That being said, overall light smoking has increased over the century. Studies have found that the younger an individual starts smoking, the harder it is to quit later on. If they start before the age of 20, they are likely to become dependent on nicotine more quickly. A few reasons have been cited for this trend. Biologically, adolescents may be more susceptible to the rewarding effects of nicotine. This is especially so for those who are highly hostile or aggressive. Furthermore, psychologically, adolescents are prone to increased novelty seeking, which makes them more receptive to advertisements for smoking. Exposure to smoking through media, such as movies or TV shows, also increase the likelihood that adolescents will initiate smoking early on. Nicotine acts as a stimulator to receptors that are sensitive to acetylcholine, ACH, which are involved in the slowing down of neural activity. That being said, nicotine is a biphasic drug. This means that in low doses, it acts as a stimulant for these ACH receptors, but at higher doses, it actually slows down neural transmission. Nicotine can be absorbed through several areas, for example, the oral, buccal, and nasal mucosa, the gastrointestinal tract, or the lungs. It is most readily absorbed through the lungs, which is why smoking cigarettes can provide the quickest high. The way in which nicotine is delivered also affects how well the absorption happens. The less acidic the medium being used, the easier the absorption. The length of contact also affects absorption. The longer the contact with nicotine, the greater the amount absorbed. If inhaled, nicotine can reach the lungs in 7 seconds, and within 3 to 5 minutes, it can reach peak levels in the brain. It has a relatively quick half of 10 to 20 minutes, and therefore its effects can be quite rapid. And so continuous puffs of smoke can create this overlapping presence in the brain, in which there's a mix of old and newly absorbed nicotine at the ACH receptors. Tolerance develops very quickly. In an individual's first attempt at smoking, they can feel the signs of nicotine poisoning, such as palpitations, dizziness, sweating, nausea, or vomiting. But as quickly as they appear, these signs can go away within the same first attempt. It only takes a short time to become a seasoned smoker. People can easily become physically dependent on nicotine, making it a very addictive drug. A study by Hughes and his colleagues found that even just 24 hours after smoking, withdrawal symptoms can occur, such as cravings for tobacco, irritability, anxiety, difficulty concentrating, restlessness, increased appetite, impatience, somatic complaints, and insomnia. This may be a contributing factor to why smokers need to smoke so often. Nicotine is a general central nervous system stimulant, which means it increases the amount of activity in the brain. Some examples of these stimulating effects are an increase in behavioral activity, the development of tremors, increased fluid retention, reduction of muscle tone, and enhancement of alertness, learning, and memory. Nicotine can affect other bodily functions as well, including increasing heart rates, blood pressure, and the contraction of the heart. Yet in higher doses, nicotine produces opposite effects, acting as a depressant and slowing down neural activity. Nicotine is also associated with lower body weight due to decreased appetite for sweet foods and an increase in the amount of energy the body uses. Previous research has found that smoking in middle school students is often related to their attempts at dieting. That is why weight loss is a powerful motivator for people who smoke. The pairing of nicotine-stimulating effects on the central nervous system and the perception that smoking tobacco is sedating is a significant reinforcer for smokers. They are able to feel alert and relaxed through smoking. Nicotine is also highly accessible, and due to its rapid rise and fall in the blood levels, it can lead to people needing to smoke multiple times in a day.
Chronic use of products containing tobacco has been widely known to have major consequences to one's health. Some of these life-threatening issues include, but are not limited to, lung and oral cancer, chronic obstructive pulmonary disease, heart disease, stroke, and diabetes. When common diseases were compared between smokers and non-smokers, the results of chances of dying from heart attack, stroke, or lung cancer were significantly higher for smokers from age 30 until old age. Because of major health risks of ingesting tobacco frequently, it has become law for cigarette companies to include gruesome images of lung and oral cancers in hopes of discouraging users from using those products. The reason why smoking cigarettes is so harmful to the body is because of continuous exposure to tar, nicotine, and carbon monoxide. So let's talk about how each of these aspects plays a part. Carbon monoxide. Cigarette smoke is known to carry large quantities of carbon monoxide. Excessive exposure to carbon monoxide is known to expedite the disease process for smokers. This process occurs because exposure to carbon monoxide reduces hemoglobin levels in the body, which are crucial for binding to oxygen in order to transfer oxygen from the lungs to tissues in the body. Lack of hemoglobin will lead to deprivation of oxygen in the body's tissues. Carbon monoxide also creates vulnerability to the brain and heart due to a disruption in aerobic respiration. Tar is known to be the most significant cancer-causing substance in cigarette smoking. Tar is the tacky brown or yellow chemical that is left over in the filter after a cigarette has been smoked. Tar is known to paralyze the cilia in lungs, which leads to lung diseases. There is 12 milligrams of tar present in cigarettes. Nicotine is the addictive substance in cigarettes. It is derived from the tobacco plant. There is 0.88 milligrams of nicotine in a cigarette. Nicotine is known to increase blood pressure, heart rate, flow of blood to the heart, and narrowing of the arteries. Though the contents of nicotine and tar in cigarettes has been decreased significantly over the years, it doesn't necessarily mean people are ingesting less of it. Knowing that there's less nicotine in the cigarettes consciously or subconsciously prompts individuals to smoke more cigarettes or inhale the smoke more intensely to get a stronger effect. Smoking cigarettes is very closely linked to many life-threatening diseases. It is proven that people who smoke are twice as likely to develop heart diseases compared to non-smokers. Also, smoking is linked to cancers of the larynx, oral cavity, esophagus, bladder, pancreas, and kidneys. 30% of all cancer deaths are known to be linked to smoking, and 80 to 90% of all lung cancer deaths are known to be linked to smoking. Also, 80 to 90% of all chronic obstructive lung diseases such as emphysema are caused by smoking. These are some undeniable statistics. Fortunately, though, quitting smoking cigarettes tends to significantly decrease these risks. There are also some unique consequences for women who smoke. These women are at a higher risk of cervical cancer, unwanted side effects for oral contraceptives, and early menopause. Also, pregnant women who smoke pose the risk of miscarriage, premature birth, low weight babies, and fetal and infant deaths. There are multiple other tobacco products currently on the market, including pipes, cigars, and snuff. These are not healthier alternatives and still develop higher death rates compared to non-smokers. The most significant difference, though, is that the pipe smokers and cigar smokers tend to consume less tobacco. Snuff and other smokeless tobacco users, on the other hand, have a higher chance of getting oral cancer due to the method of use. Smoking around others holds its own risks. When in close vicinity of someone that is smoking, people will absorb small amounts of nicotine, carbon monoxide, and other elements of the tobacco smoke. This is considered passive smoking, as you are not the one that is actively smoking. It is proven that approximately 53,000 Americans die every year from passive smoking in their household, which makes it the third leading preventative cause of death after smoking and alcohol. Passive smoking affects children just as much as adults. Research has shown that a fetus that is exposed to cigarette smoke during the gestation period is more likely to develop bronchitis, pneumonia, and impaired pulmonary functioning. Cigarette smoking accounts for a vast majority of tobacco use, which is why we'll be focusing on treatments for this. Individuals may have a variety of reasons for wanting to quit smoking. The reasons can be categorized into two categories, which are intrinsic motivations and extrinsic motivations. Some common intrinsic reasons for wanting to quit smoking include the fear of getting sick, feeling in control, and proving to others that quitting is possible. On the other hand, extrinsic reasons can include nagging from family and friends, being forced to quit, and saving money. When successful in quitting smoking, there is always a chance of relapse. Common smoking relapse determinants include nicotine withdrawal symptoms, stress and frustrations, social pressures, alcohol use, and weight gain. Pomerleau also stated that individuals with psychiatric disorders such as depression, anxiety, bulimia, ADHD have a lower rate of quitting smoking compared to individuals that might not have these. Studies have shown a decline in smoking rates among U.S. adults since the 1960s. Approximately half of the living adults that said they smoke have now quit, and a majority of those individuals stated that they quit on their own. So this poses the question if formal treatments are actually necessary or not. There are multiple points to consider when thinking about this question. Firstly, for the people that quit on their own, it usually takes them multiple attempts to be successful. Another point to consider is spontaneous remission. This is a calculating method to determine the rate of being cured during a specific time period without any treatment. Economics and social costs of cigarette smoking also plays a part. In 1995, cigarette costs were at $135 billion. This doesn't even begin to cover the suffering of smokers and their families when they're diagnosed with cancer or heart disease. Findings from 1991 prove that quitting smoking prolongs life, increases longevity, and reduces the risk of major illness that comes from smoking. Treatment programs focus on helping to stop smoking by focusing on controlling nicotine withdrawal symptoms and breaking habitual behaviors. This can be done by learning skills that will help individuals cope with their emotions and thoughts and getting through the periods where they might have used cigarettes as tension relievers. The two types of treatments available are behavioral programs and nicotine replacement therapies. Behavioral programs have changed significantly in the past 10 years. In the past, behavioral programs involved ongoing and frequent contact with clinical staff over the period of 2 to 3 months. These meetings could occur as individual sessions or in a group format. The focus of this treatment format was to get individuals to identify their high-risk situations that usually led them to smoking. When those situations were identified, the smokers were taught coping mechanisms and self-monitoring techniques to break their cycle. Now the evolved behavioral program involves some direct and some telephone or virtual contact with professionals. The frequency now takes a more as-needed approach. However, the core format of identifying triggers and learning coping mechanisms remains the same. Nicotine replacement therapies consist of placebo or administering nicotine in different methods in hopes of helping individuals slowly wean off of smoking cigarettes. These treatments include nicotine gum, nicotine patch, nicotine nasal spray, or a nicotine inhaler. These methods are used to control cravings of nicotine that arise. Though nicotine replacement therapies are not as effective as behavioral programs, there are significant findings that combining both treatments lead to the best outcomes. Nicotine is a highly addictive and reinforcing drug that has some effects that improve sensory and cognitive functioning. However, the negative aspects of the drug seem to outweigh the positives. There is still a strong emphasis on from using nicotine. Early education, informational campaigns, and other macro-environmental methods continue to discourage people from smoking. In the coming years, it's very likely to see more treatment methods surfacing, developing and testing more effective treatment methods will, in turn, lead to a healthier population.
Alcohol is one of the most popular psychoactive drugs. Alcohol has actually been known, manufactured, and used for the longest by far as compared to other substances, including caffeine and tobacco. The oldest known recipe is actually for beer. Alcohol typically is referred to several different substances, including isopropyl alcohol, also known as rubbing alcohol, methyl alcohol, also known as wood alcohols, and ethanol. Typically, when we talk about drinking alcohol, we're talking about ethanol, and that's what we're going to be using for the rest of the paragraphs or slides. Typically, there are three major classes of manufactured alcohols. This includes beer, wine, and hard liquors or distilled spirits. Your beers and wines stop at the fermentation process, which the fermentation process is the mixture of sugars that's been dissolved in water and exposed to air. This creates the perfect environment for microbial bacteria and organisms called yeast. Yeast then eats the sugar and releases carbon dioxide and ethanol. The carbon dioxide bubbles to the top of the mixture, leaving just the ethanol. Typically, yeast will stop growing when the ethanol reaches up to 10 to 15% in the beverage. This is why your beers and wines are not above 15% alcohol. To further the alcohol content increasing it, distillation was created, which uses the fermented beverage and it boils off some of the ethanol, which is caught and condensed later, and that is what you have as your alcohol. Your distilled liquors include whiskey and rum and anything that's over 15% alcohol. Now that I've talked about what alcohol content is in a thing, what does it actually mean when you say alcohol content? So, typically when you're talking about 50% alcohol, it means that 50% of the beverage in the glass is alcohol. So if it's a 16-ounce beverage, about 8 ounces of that beverage, or 50% of it, is ethanol. Typically, that's how we do it in most countries, but England does it by weight specifically. So when we're coming to talk about proof, it's not the same thing as alcohol content, but it does use alcohol content. Typically, alcohol content is, or proof is considered alcohol content times 2. So if a beverage has a alcohol percentage of 46%, it's proofed 86, or it's 86 proof. When it comes to underproof and overproof, this is a term that started in the 17th century England, where it was determined that 50% alcohol by volume, if poured into gunpowder, would initiate an open flame. So the English would still refer to beverages as overproof if it's over 50% alcohol by volume, meaning it would light the gunpowder. And if it's underproof, it means it's below the 57% alcohol. It is assumed that the history of alcohol started off as an inadvertent fermented fruit juices, which we get your wines, and then beers were probably produced in Egypt between 6000 BC and 5000 BC. And some suggested that humans were intentionally producing alcoholic beverage as long as 10,000 years ago. Traditionally, it's been thought that beer was produced by baking bread. So an earthen worn vessel would be filled with barley and was placed in the ground and forced to germinate a little bit. At this point, the barley was crushed, making a dough, and then baked to form a crust. This cake of dehydrated dough was soaked into water and then would be allowed to ferment, and this would produce an acidic beverage that was nicknamed boozah. So Boozah. Now, there's been studies from tombs dating back to 2000 BC, stating that there's possibly a more sophisticated brewing process in this. This was just maybe one of the earlier ones. When distilled beverages were introduced, it was typically believed to be from China around 1000 BC, and Western Europeans didn't really have any records of production or consumption of distilled beverages until 800 AD. When the alcohol was consumed that was just beers and wine, it was not viewed as a negative part of society. Actually, alcohol was viewed as a way of an important role. It played an important role in social occasions, births, religions, ceremonies, marriages, and funerals, and it was typically not really harmful to the individual. Remember, this was when alcohol was below 15%. So basically, most of what you were drinking was water or some other liquid. It was when colonial Europe or colonial America started adopting alcoholic beverages. It's believed that the Pilgrims landed on Plymouth Rock instead of their planned route of Virginia because they ran out of booze and alcohol. With this and the advent of the tavern being the center of town politics, business, trade, and pleasure, it was believed that America became the country known as drunkards. They were consuming way more alcohol than ever before, and they were consuming harder alcohols. This led to people becoming more concerned about alcoholic intoxication and the long-term effects that created by alcohol. Alcohol is typically thought as a depressant on the central nervous system because it does slow down the body or the nervous system. There's also good evidence that it acts on the GABA benzodiazepine receptors, and increasing evidence that alcohol enhances serotonergic and dopaminergic activity. The pharmacokinetics of alcohol. Typically, alcohol is absorbed into the body. It's actually viewed as a food because there is a caloric component to alcohol. The things that impact the rate of absorption is you'll absorb alcohol faster if you drink on an empty stomach. You don't have any stomach or milk in your stomach. You're drinking more liquid or more beverages with alcohol faster. And if there's carbonation, that increases your absorption. It is distributed through the body via the blood. Typically, your stomach will digest it. It will go down into your lower intestines, which then it is spread into your bloodstream. And then once it's in your bloodstream, it hits your brain. What is considered a lethal dose is 25 standard drinks in 1 hour. Typically, when we measure alcohol levels, we measure blood alcohol levels, which is how many micrograms of alcohol is in 100 milliliters of your blood, or 1 milliliter of your blood. The legal amount in Canada, Europe, Puerto Rico, and District of Columbia is typically 0.08%. Now, other countries have it different, where in like Finland, it's 0.05% alcohol, and Norway, it's 0.02, along with Sweden. The lethal dose is considered to be a 0.45 or 0.5% alcohol in your system. Women tend to have less of the enzyme alcohol dehydrogenase in the stomach. This means that alcohol is broken down less in the stomach, allowing for there to be more in the system and less excreted earlier. Legally, when there is a issue with blood alcohol, they will test urine or blood because it is more accurate than any other methods. Typically, the body absorbs more than 90% of the alcohol into the body. There is a small amount of unmetabolized alcohol that is excreted through the kidneys and lungs. The liver does break down acetaldehyde by an enzyme process alcohol dehydrogenase. Eventually, the acetaldehyde is broken down into carbon dioxide and water, which is then expelled through the body normally. The rate of metabolism is independent of any other function in the body, unlike food. So when it comes to food, our body will break down food faster if we need the calories. but alcohol does not matter. If we need the calories or not, our body will break it down as fast as it decided to. Alcohol typically has 75 calories for every half ounce of alcohol in the beverage. That's why your light beers, while being low in alcohol, are also lower in calories. There is no real way to speed up the body's alcohol removal process. This means that drinking caffeine does not speed up the body's process of removing alcohol, it just tricks your brain into thinking it does.
Hi, my name is Jamil and I'll be talking about alcohol tolerance. Our body naturally builds a tolerance towards alcohol as it does with any other psychoactive drugs with regular use. This is known as dispositional tolerance. This means having to drink more alcohol to maintain a certain back. Those effects can be reversed through abstinence from alcohol, also known as a tolerance break. Functional tolerance explains the ability to function relatively normal despite having a high back. Tolerance to alcohol may be both acute and protracted. Acute tolerance to alcohol refers to the effects of alcohol at a given back, becoming greater as the back rises than when it descends, but still remains relatively high. While protracted tolerance to alcohol refers to an individual requiring more alcohol to feel the effects once felt with less alcohol, similar to dispositional tolerance. However, these people become more susceptible to serious health problems with alcohol consumption. Drinking more alcohol despite feeling the effects or not still results in high backs, which can be lethal. A physical dependence to alcohol naturally develops through chronic drinking. There is a long list of symptoms that is divided into 3 phases with respect to their time of onset, shown in the table. Some individuals may not experience all 3 phases. In some cases, individuals may go from phase 1 straight to phase 3. Back does not need to reach 0 for withdrawal symptoms to start. In fact, withdrawal might start as soon as the back starts to decrease. Next, I'll be talking about the therapeutic uses. Since alcohol is an excellent solvent, it is used as an ingredient in small amounts in cough syrup. It is also included in compounds to treat certain skin problems. Because alcohol cools when it evaporates, it can be used to treat fevers. Alcohol may also be recommended to convalescent or elderly patients before meals to stimulate appetite and digestion. Patients may also be injected dehydrated alcohol close to nerves or sympathetic ganglia to relieve chronic pain, for example, with inoperable cancer patients. And we're all familiar with the smell of alcohol through disinfectant products such as hand sanitizers. Next, I'll be talking about the physiological effects. The amount of body fat that our body oxidizes is reduced. This results in the increased body fat and weight gain, usually referred to as beer belly. Another acute effect of alcohol is the disruption of our sleep patterns by suppressing REM sleep. Depending on the dose, REM sleep can be suppressed only in the first half or throughout the entire night. Alcohol also affects our short-term memory. When our body reaches high backs through drinking fast, a blackout may occur. Blackouts are a result of when our brain fails to transfer information from short-term to long-term memory. For the most part, we've all experienced a hangover. Hangovers can begin to appear about 4 to 12 hours after reaching the peak back. Lastly, LD50, also known as lethal dose 50, having a back of 0.45% to 0.5% can be lethal due to the dysfunction of significant parts of the brain that control breathing and heartbeat. Next, I'll be talking about the sensory motor effects. Alcohol begins to have acute effects on our senses at a back of 0.05% and higher. Our vision may gradually become blurry, taste and smell become less sensitive. However, our pain threshold increases when the back is within 0.8% to 0.10%. This explains those nights when we wake up with those cuts and bruises we never knew we got. Alcohol also affects our psychomotor skills and balance, which is why the police test drivers who they suspect of drinking to walk in a straight line. The legal back to be driving in BC is 0.05% or lower, which they reduce from 0.08%. This means you have 50 milligrams of alcohol in 100 milliliters of blood. I found these statistics to be very interesting, so I thought I'd just put it up there. Lastly, I'll be talking about the psychological effects of alcohol. Emotions and mood alter as back rises and falls. Intimate partner violence and other violent crimes generally occur with alcohol use. When lockdown and quarantine mandates began, there was a noticeable surge of intimate partner violence reports all around the world. Financial stress being the most predominant factor during the early stages of the lockdown. Victims found themselves locked in their homes with their abusers, which made it difficult for them to reach out for help due to the fear of being heard and due to the lack of resources available to them. Another factor that is important to note is that throughout this whole pandemic, liquor stores remained open. The disinhibition theory suggested that alcohol enables certain behaviors that are normally inhibited by society, such as aggression. This, however, was disproven by controlled laboratory experiments, which they associated situational and personal factors to explain the increased levels of aggression with alcohol use.
I'm going to be talking about the effects of chronic heavy drinking, some different body systems affected by alcohol, and how alcohol use disorder develops. Before we talk about heavy drinking, we have to define what safe drinking is. An estimate provided by the U.S. National Institute on Alcohol Abuse and Alcoholism on safe drinking for men is no more than 4 drinks a day and no more than 14 drinks in a week. And for women, it's no more than 3 drinks in a day or 7 drinks in a week. Now let's talk about some of the effects of heavy drinking. In 2012, alcohol caused almost 6% of global deaths. That's a huge number. Chronic heavy drinking affects multiple body systems, including the central nervous system, the cardiovascular system. There's an increased mortality from coronary heart disease and increased risk for cardiovascular disease. It affects the immune system. There's an increased susceptibility to many infectious diseases. It also affects the liver, endocrine, and gastrointestinal systems. Chronic heavy drinking also increases your risk of developing multiple cancers, such as oral cavity cancer, tongue cancer, pharynx, larynx, esophagus, stomach, liver, lung, pancreas, colon, and rectum cancer. Let's talk about alcohol and the brain. The effects of moderate alcohol use are reversible, but long-term alcohol use can severely impair cognitive functioning and cause irreversible structural and functional brain damage. Let's talk about a specific disorder. Wernicke-Korsakoff syndrome is a central nervous system disorder that's a combination of 2 diseases, Wernicke's disease and Korsakoff syndrome. Wernicke's disease is caused by a vitamin B1 deficiency, and its symptoms include confusion, loss of memory, and staggering gait. If there's no permanent brain damage, the disease can be reversed by giving the patient vitamin B1. Korsakoff syndrome is caused by chronic heavy drinking, which causes damage to the brain's areas responsible for memory. It causes serious impairments in learning and short-term memory. Because this syndrome impairs a person's memory, when they're asked questions about themselves, they will confabulate or fabricate events because they cannot remember. Chronic heavy drinking impairs both male and female reproductive functioning. In men, it affects their male sex hormones. Alcohol causes damage to the liver, so more estrogen is absorbed into the blood. The balance of testosterone and estrogen is thrown off, and this can cause a loss of sexual desire and also cause males to grow breasts, a condition known as gynecomastia. Secondly, alcohol inhibits reflexive responses in the nervous system, which can affect sexual performance and can cause impotence. Chronic heavy drinking can eventually cause you to become sterile and can impair sperm production, so much so that defective offspring can be conceived. In women, chronic drinking is associated with dysfunction of the ovaries, disruption of the luteal phase of fertilization, and can cause them to miss their period. If a mother drinks during pregnancy, it can cause a child to be born with fetal alcohol syndrome. Fetal alcohol syndrome has received a lot more attention in recent years. In 1973, there was a clinical report on children of mothers who drank during pregnancy who were born with physical deformities. These deformities included small eyes and small eye openings, drooping eyelids, underdeveloped mid-face, skin folds across the inner corners of the eyes, underdevelopment of the depression above the upper lip, and small head circumference. There were also abnormal creases in the palms and abnormalities in the joints. They did a 10-year follow-up on these children and they showed low normal to severely impaired intellectual functioning, physical deformities similar to those originally reported, and other physical problems. Scientists don't know what the safe level of drinking a mother can do during pregnancy is, so the best thing to do is avoid drugs and alcohol altogether during pregnancy. Some people who drink heavily develop problems with alcohol use, and this can have devastating consequences on themselves and their families. How does alcohol use disorder develop? Researchers for the longest time believed that a single factor could explain what causes alcohol use disorder. They thought maybe it was biological. Someone had a deficit in alcohol metabolism, maybe they were allergic to it, or maybe some people are just genetically predisposed to developing alcohol use disorder. They also considered psychological explanations. Maybe there's an alcoholic personality, which is a set of traits that make some people more likely to develop alcohol dependence. They also considered sociological explanations by looking at differences in drinking patterns across cultures and demographics. All these single factors have some merit, but the most current thinking among scientists is that multiple factors combine to cause alcohol use disorder. It's a combination of biological, psychological, and sociological factors. These biopsychosocial factors are what cause and maintain alcohol and other drug use disorders.